Senator Becca Rausch worked on legislation which addresses racial justice and maternal health equity. Here's more on the commission it would establish.
Even now, even in 2021, Black people giving birth in our Commonwealth are still more than twice as likely as white people to die due to complications during and after childbirth. When we say Black Lives Matter, we must also recognize that systemic racism exists in all of the systems that we maintain in this nation, and that includes, but certainly is not limited to healthcare. And we see that in maternal health morbidity and mortality right here all across the Commonwealth. As elected officials, it's our duty to craft and enact legislation to combat these stark health disparities and to provide affordable, accessible, and safe maternal health care regardless of race or zip code. So when my colleagues and I enacted this legislation just earlier this week, we demonstrated our recognition of the existence of systemic racism in our healthcare system, and also furthered our collective commitment to protecting and preserving the health of Black and Brown birthing people throughout the Commonwealth. The iteration of the legislation that we enacted provides significant specificity as to the members of the commission, expressly calling in many maternal equity organizations that center the voices of Black and Brown birthing people and their families all throughout Massachusetts. And that is particularly important. Another important piece of the commission is the deadline. So as a legislator who is particularly dedicated not only to advancing racial justice, but also public health and maternal health and equity and justice, I am very much looking forward to the recommendations of this commission coming forward in March of 2022, which is the deadline set in the legislation and the resolve that was enacted, so that we can put these recommendations into action. That's our job. Listen, be a steadfast ally, and enact legislation that will meaningfully make a difference on the ground to advance maternal health equity and justice. So I very much hope the governor will sign the bill so we can get moving. I am really grateful to so many people whose leadership and advocacy made this bill possible and made this commission a hopeful reality. I strongly encourage and urge Governor Baker to sign the bill so that the commission will be formally established and we can get to work. But I do want to thank our Senate President and the members of her staff, the many colleagues in the Senate who helped to move the bill along, and particularly my House co-lead filers, Representative Liz Miranda and Representative Kay Khan, and the truly amazing advocates, particularly at NARAL, Massachusetts, and in the broad coalition of folks that make up the COVID-19 Maternal Equity Commission, coalition, excuse me. And they are the driving force behind this bill. And I'm really proud to have been a part of it, and deeply grateful to everyone in the district who has reached out over the course of the last many months to demand action to advance racial justice and equity in our Commonwealth. And I'm really honored to be a part of this work.